Hi, my name is Stephanie Firo, and I'm a speech language pathologist with Verse Therapy. And I wanted to talk to you guys today about a common question that we get in speech therapy, which is how long is therapy going to take? There's a lot of different factors that influence how long you or your child will need speech therapy for. And unfortunately, of course, we don't have a crystal ball to stare into to see exactly how long it's going to take, but there are some concepts that we can look at that can give us a general idea of how quickly you or your child might make progress. Some of the most important factors in how quickly that progress is going to be made is your rapport with your therapist. Not every therapist and every patient is going to be a good fit. The therapeutic relationship is actually really special and kind of vulnerable. So it's actually super important that you and your therapist are on the same page and have the same understanding of the goals that you want for you or your child in therapy. Aside from rapport with your therapist, one of the biggest success indicators for therapy is that the child or the parent or the patient fully understand the purpose of therapy. A lot of the time, especially with children, therapy can look like play, but play is actually a really critical skill, and it's how children learn. So within that skilled play that you see your speech therapist doing with your child, it's also integrated with the goals that were created, personalized for your child. So all of that to say, one of the biggest things that I can recommend as a speech therapist to all of my patients and parents is to ask questions and make sure that your therapist that you're paired with is able to answer those questions so that you fully understand the activities that are assigned to you and that you fully understand what the direction of therapy is. From my experience as a speech therapist, one of the biggest ways to make progress in therapy is to do your homework that's assigned to you. And homework can be really fun. Sometimes it's assigned in worksheets and word lists, but your therapist should be giving you creative ways and ideas to target those words at home. When you go to therapy for 30 minutes once a week, that's less than 1% of your time of that week. Those 30 minutes are critical to lay the foundation for the skills that are being addressed and to give you guidance and direction for what you should be doing at home to support your child. And with lots of home program practice, you can bring that 1% up significantly so that your child is getting meaningful repetition and practice of the speech and language skills that they're targeting in therapy from the goals that your speech therapist made you. So all of this to say, those are some of the biggest factors that in my career as a speech therapist, I've noticed my patients that make the most success are the ones that I have a great relationship with, that they understand the goals and the function of all the therapy tasks that I recommend, and they do all of their speech homework at home.